Hello, good morning. Good afternoon. I'm sorry. Fellow rehabilitation staff, I'm thrilled and honored today to have this presentation about a very interesting subject and also a tools. This is like something that we could use for stroke patients. So first of all, before I started, I'm gonna kind of give you guys a little view of everything I'm gonna be talking about. The subject will explore I'm gonna explore the origin, where does that come from, the neuroplasticity therapy, and also the evidence from articles. I got two different articles that I have here. If you guys wanna go over it later, I'm happy for you guys to do that. And I'm also gonna emphasize the optimized patient outcome from using the neuroplasticity therapy. So first, before I even get into its origin and everything, I want to explain to you guys how I come up with this idea. He was doing a treatment with one of our stroke patients, which you guys already know. I'm not going to mention the name. And then my fieldwork educator, Vernon, was discussing about different strategies that we could use with that patient. And he was like, okay, what about if we use the mirror, put it in between, so the patient could see his strong arm moving and stuff like that. And that kind of sparked my curiosity to do further research when it comes to that. So this is how I come up with the neuroplasticity therapy. So neuroplasticity therapy is origin, like you guys usually, that's the way it is with physical therapy. You know, you guys have a lot of research out there, and I think that's one of the reasons why now OT is transitioning to a lot of evidence-based practice. We're having a couple more research. But it was hard for me to find some OT research about it, but I did find mostly like the physical therapy research. So if I use the origin in the year of 1990 his name is Ramachandran. He's actually created this concept for fatal limb patient. Fatal limb pain and also fatal limb, which most likely they always go together. So he found out about it and he became really successful with the concept and everybody was actually using it. And later his scope kind of exploded more like to stroke patient and other neurological issues. So with the stroke patient, like I'm gonna present the equipment to you guys. It's not a medical equipment, but it's very useful in evidence-based practice. Okay, that's the way it looks like. I'm gonna open it. That's the inside, and that's the outside. So very simple, could be used at a different type of setting. It could be used in rehabilitation, and also if you send the patient home, we comment something like that and kind of do a caregiver training with home exercise programs so they can actually practice at home. So yeah, that's the way it looks like. And I'm gonna give you a little demonstration with a patient that have an AD paralysis, one side weakness, that can actually use it with just one hand. They can just open it this way and then do it this way, and they can push it. And actually the strong arm will be outside, and they can grab the affected arm and put it inside. So they're not gonna be able to see the affected one, but they will be able to see the strong side, which you can give them a home exercise program with wrist flexion, extension, all kind of different motion, and they will actually doing it while they're actually looking what they're doing. The interesting part, I'm gonna get in that part, why is it important for them to do that? It's important because neurotherapy leverage the brain neuroplasticity. Retrain motor pathway is like sometimes our brain doesn't know the difference between imagination and reality. They're confused. So it's a way to treat the brain, make the brain think that, okay, this is my left arm moving when the patient is looking at in the mirror, when it actually is good arm.